Low blood sugar, also known as hypoglycemia, can come on quickly, so it's important for the person with diabetes, their family, and friends to know how to treat it to prevent a severe reaction. It's also important to carry the supplies needed to treat it with you at all times. A low blood glucose, otherwise known as blood sugar, is considered to be any reading below 70 milligrams per deciliter. Recognizing the symptoms of low blood sugar varies from person to person, and young children in particular may not be able to tell when they're having symptoms. Follow the recommended treatment in order to prevent more severe reactions. The body usually gives a warning that the blood sugar is getting low. It's important not only for the person with diabetes to know these warning signs and symptoms of hypoglycemia, but also their family, friends, and people who may be with them on a regular basis, like teachers and caregivers, who also must be able to recognize these symptoms and know exactly how to treat it quickly. Some of the most common signs and symptoms of low blood sugar may be increased hunger, a weak or shaky feeling, irritability, appearing pale, and feeling tired. Symptoms can quickly progress to having difficulty concentrating, complaining of a headache, behavior changes, drowsiness, confusion or trouble thinking clearly, loss of consciousness, or even a seizure. Hypoglycemia can happen when the body does not have enough sugar to burn for energy. This can be caused by having too much insulin when your current dose is too high, or maybe you gave more than the amount prescribed. Also, more than usual exercise or activity, not finishing a meal, eating less than 3/4 of the planned carbohydrates, or giving a shot into the muscle instead of fat. Low blood sugar can come on fast, so it should be treated right away. A person with diabetes or the parent of a child with diabetes should always carry a source of fast-acting sugar with them at all times. Examples of easy-to-carry fast-acting sugars include a 4-ounce juice box, 3 to 4 glucose tablets, or a small tube of cake icing or gel. Any one of those items is equal to 15 grams of carbohydrate. For a mild to moderate low blood sugar, you should follow the rule of 15s. For a severe low blood sugar, you may need to use glucagon, which we'll discuss in a moment. The rule of 15s is the basic protocol to follow if the person's blood sugar is below 70, but they're awake, alert, and having a mild to moderate reaction. First, eat or drink 15 grams of fast-acting sugar, otherwise referred to as carbohydrate. Wait 15 minutes and retest the blood sugar. If it's still less than 70, have another 15 grams of fast-acting sugar and wait another 15 minutes, then retest. Once the blood sugar is back over 70, have a 15-gram snack containing complex carbohydrate. If you already had planned to have a snack or the low blood sugar occurred before a planned meal within the next hour, you do not need to have that complex carb snack. Glucagon is a hormone made in the pancreas, like insulin, but it has the opposite effect of insulin and actually raises the blood sugar level. Glucagon can be stored at room temperature but should not be exposed to extreme heat above 90 degrees or below freezing temperatures. Check the expiration date on the Glucagon kit twice a year. A good way to remember to check is to do it when you turn the clocks in the fall and spring. On our website is a step-by-step guide to using glucagon. It should be given if your child is non-cooperative or unable to take treatment by mouth, is unconscious, or having a seizure. A side effect of glucagon is possible nausea and vomiting, so an unconscious child should be positioned on his or her side to avoid choking. If the blood sugar is still not improving within 15 to 20 minutes, a second dose can be given. Once awake, the child should be given fast-acting carbohydrate followed by a snack of complex carbohydrate and protein. Always notify your diabetes team of a severe low blood sugar reaction that required glucagon before the next dose of insulin is due, in case a dose adjustment is needed. Once again, you'll find a step-by-step guide to using glucagon on our website located to the left of this video.